Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we're exploring something that too many people living with chronic and rare diseases know all too well: the emotional and physical exhaustion of trying to get an accurate medical diagnosis. When symptoms don't make sense, when you're dismissed by doctors, or when the system keeps failing to connect the dots, the toll goes far beyond the body. It affects your mental health, your relationships, your finances, and your sense of self. In this episode, we'll hear firsthand from Mahsa Pazokifard, who spent years searching for answers before finally being diagnosed with a rare autoimmune condition called IgG4-Related Disease. It's a chronic, immune-medicated condition that can inflame multiple organs in the body, and like so many rare diseases, it's often misunderstood or missed entirely. Mahsa's story shows how long, painful diagnostic journeys can test your resilience, and also how advocacy and community can rebuild strength and purpose. But before we get into that with Mahsa, we're going to talk about the recent federal government shutdown, what it meant, how it ended, and why it matters for healthcare and patients like you. All right, let's get into it. What is a government shutdown? A government shutdown occurs when Congress fails to pass funding legislation or a continuing resolution by a particular deadline, typically the start of a fiscal year on October 1st. Agencies must then stop non-essential operations. Federal workers may be furloughed or work without pay, and key services get disrupted. Over the past 30 years, there have been multiple shutdowns, each causing economic, social, and health impacts. But the one we just saw became the longest in U.S. history. So why did this particular shutdown happen? The 2025 shutdown began at midnight on October 1st after funding bills for fiscal year 2026 were not passed. The impasse stemmed from deep disagreements over spending levels, proposed cuts, and policy riders. A major flashpoint was the upcoming expiration of enhanced subsidies under the Affordable Care Act. Democrats insisted the subsidies must be extended before the reopening of the government. Republicans resisted, calling it a separate negotiation. The divide made finding a deal elusive, and the shutdown dragged on. Why the ACA subsidies were central. The Affordable Care Act premium tax credits help millions of Americans pay for health insurance on the marketplaces. With those enhanced subsidies set to expire at year-end, Democrats argued that even if the government reopened, healthcare costs would spike and coverage losses would follow. The subsidies became leverage in the budget standoff, turning a spending fight into a health policy showdown. If the subsidy cliff hit, younger and healthier consumers might exit the insurance markets, pushing premiums up and threatening access. After more than 6 weeks, a breakthrough finally emerged during the shutdown. On November 10th, the Senate passed a funding bill by a vote of 60-40. A small number of Democrats broke ranks, allowing Republicans to reach the supermajority 60 votes required to overcome the Senate filibuster. That enabled the funding legislation to move to the House of Representatives, which approved it a day later. President Donald Trump signed the bill, ending the shutdown. The agreement funds most agencies through January 30th, 2026. Reinstates pay for federal workers and avoids further layoffs for now, but it does not include a committed extension of the Affordable Care Act subsidies. Instead, it sets up a future vote in December, leaving that question unresolved. With agencies reopened, the immediate crisis is over, but the next chapter is underway. Congress must decide how to address the expiring ACA subsidies. Without extension, insurance costs could rise dramatically, especially for low and middle income households. Health policy watchers are also looking to see how federal health agencies recover from the shutdown's disruption. Research pauses, delayed grants, paused regulatory reviews, and slowed public health communications all need catching up. There's also the matter of whether future funding deals will include guardrails preventing unilateral cuts or further shutdowns. For patients, especially those managing chronic or rare conditions, this shutdown highlights how intertwined health policy and budget politics are. If subsidies are lost, insurance premiums rise, access shrinks, and financial barriers grow. If federal agencies remain underfunded or disrupted, research and oversight falter, impacting everything from drug approvals to disease surveillance. The takeaway: health policy isn't just about treatments and clinics, it's about the rules, funding, and stability behind the system. Advocacy, awareness, and engagement matter. The end of the shutdown is very welcome, but the work is far from done. As we turn the page, patients, advocates, providers, and policymakers all need to stay plugged in. Funding decisions made behind closed doors come home to every person with a condition, a loved one, or a treatment need. All right, well, if you thought that was a lot to take in, let's all take a breather because the government is reopened. And now we're going to turn to Mahsa Pazokifard, who spent years searching for answers before finally being diagnosed with the rare autoimmune condition known as IgG4-Related Disease. Mahsa, thank you so much for joining us today. Your story is powerful, and I know it's going to resonate deeply with many of our listeners.
Steven, thank you, and thank you for having me as a part of this podcast. I'm excited.
Well, let's start by getting to know you a bit. Can you tell us about where you're from, what you do today, and what keeps you inspired in your daily life?
Yes, absolutely. So I am 35 years old. I live in Orange County, California. So what I do is I am a patient advocate. I have co-founded and run a nonprofit foundation for our IgG4 community. I am a patient columnist. I have consulted with different organizations for our rare disease group. And what keeps me inspired is actually our patient community. The fact that everybody is still struggling to get the diagnosis, to get the treatment, and then the continual of care after that is where we're still struggling. So it's never over at just one point. And because of that, nobody's speaking up. The system isn't going to change itself if nobody shares their story or at least tries to tackle some of these injustices that we're facing. And so the patients are what inspire me. I talk to them all day, every day. I speak to them globally. Just the other day, I spent 3 hours with a patient in Pakistan. And so I really take the time to understand where we're missing stuff and why our patients are falling through the cracks. And all of that just fuels the fire under me to go forth and keep advocating and keep pushing through and just to bring about the same level of equity in healthcare, just for everybody, and make it accessible all across board.
And you said that your symptoms started in childhood?
Yes, actually, at infancy, I've always struggled with ENT infections. My parotids were always inflamed, and we just never knew why. I would just get infections, and then my eyes, and it just kind of spread throughout the years. My lungs got involved, and then the severe allergies started, and then it hit my GI tract, and it wasn't until 6 years even after that, in my late 20s, that I lost function of my gallbladder and I guess part of my pancreas, because they also removed that with my gallbladder. And so it's been an ongoing journey. And then 4 years ago, it all came to a halt as well with everything involving. So my eyes puffed shut, just ears, stabbing pains, my neck, submandibular, everything just swollen. And then I also actually have Sjogren's disease. So a whole challenge getting both of it diagnosed. And then proving that you have both afterwards has been a struggle for a lot of us patients, because a lot of doctors just want to say, no, you either have this or that. And it hasn't been until just recent few months that they're accepting the fact that, okay, both can exist in one patient. But it's treatable, it's manageable, but getting that treatment and that to that manageable place is quite a task. And without direction, we're lost.
Yeah, so just taking a quick step back, what was it like going from specialist to specialist? Can you just walk us through what that was like for you to deal with that and all those years, decades even, without a proper diagnosis?
Yeah, so going from specialist to specialist has been a constant occurrence in my life. And so I'm not a stranger to it. But of course, in the last few recent years, just the last decade itself, it was back to back. I mean, in 1 month, in every week, 4 days out of it, I was at a doctor's office or doing a test or a scan or drawing blood. And it gets really tiring. It was so exhausting, so stressful, because you go through all of these procedures, all of these tests, and then for the doctors just to turn around and say, no, you don't have anything. All your blood work is fine. Your vitals are fine. I remember I even fainted one time from my POTS. Now I know I have POTS. And they thought I was faking it because they had me hooked up and they're like, oh, well, your vitals are fine. And I had no idea. I was like, okay, well, I still went ahead and fainted. I mean, I don't know what to tell you. And so it's just been dismissals, gaslighting. I've faced ageism, sexism. They're like, you're too young to have anything serious. Your body's healthy. These diseases affect men, or they disease older women and things like that, where just keeps pushing and delaying the fact that we need that diagnosis. And for a lot of our patients, it is crucial for our patients to get diagnosed in a timely manner, because we do have to face worse consequences if we don't get the diagnosis, like organ failure or possible cancers even.
So after years of uncertainty, you finally received a diagnosis of IgG4-related disease. What was that moment like for you? How did you feel when you received that diagnosis, and how did that diagnosis come to be?
So, that was not that long ago, but it feels like forever ago. About 4 years ago, I believe I woke up with my eyes puffed shut. I was in severe pain and I just didn't feel good. My body was stiffening up. I was having muscle spasms. I was having tics that looked like Tourette syndrome. There was just a lot of things happening, and it was happening so rapidly. Like every day, something new was getting involved in my body, and I became partially paralyzed. I couldn't even hold a water cup in my hands. Just my hands were so stiff and just a lot of pain. And I kept having dysautonomia flares, so I had to be flat the whole day, every day. That was kind of rough for me because doctors were still not figuring it out. They were testing me for regular antibody tests and this and that. And I'm what you call a seronegative patient. So how I felt right after getting the diagnosis was kind of an aha moment for me. A little bit of relief, a little bit of hope, but mainly it was, I told you so. And then followed by more frustration because how I got the diagnosis is that I had to find the right surgeons to do the right biopsies. I had to really self-advocate in that level, and I had to tell them what to look for. So they would ask me, what do you think it is, before they go in for the biopsy. They would put that in the notes to the pathologists. And so I said, go in for Miculix. It's characterized by IgG4 patterns. I had memorized these things and I didn't even know what it meant. Just saying that and the doctors putting that down for the pathologist to test and stain your sample for, that was what saved me. Because then they would come back and say, oh, you were right. It's confirmed exactly what you said is what you have. And it's quite rare and you don't have it in your blood. And so it was frustrating to know that I had to go through all of that to get myself the care and the treatment and to save my own life. I had to do it. I didn't have any more faith left in the medical community. And so it was relief, it was hope, it was frustration. It was just a mixture of emotions for me.
And how did the doctor or your medical team finally get to that diagnosis? What was the specialist? How did you get referred to that specialist? What led to them to actually make the diagnosis?
So I have an ophthalmologist. I also had an ENT do my lip biopsy, neurologist doing all the muscle weakness, nerve damage tests. But each specialist that I saw would send me to another 2 or 3 specialists in the same line. So I have 3 ophthalmologists, I have 3 ENTs, I have 1 ear specialist. It's a whole care team. But the ophthalmologist and the ENT were able to do the biopsies that I asked them to do and to stain for what I needed them to do. And within a week of each other, they both tested positive for exactly what I had said.
So what do things look like for you now? What is your daily life like? What's a good day versus a hard day?
Every day is like waking up and having to spin a wheel of fortune. Or as how we would like to joke around, and we call it the Russian roulette, because you really don't know what to expect day to day. Just because I could yesterday doesn't mean I could today. I have good days where I could probably get 4 things off my list of to-do things, whether it's work, a little bit of house chores. I just have to make sure that I don't overexert myself and that I just don't push my body too far, because the recovery period after that, the crash out, is quite long and difficult for us. But I wake up, I try to feed myself so that I can take my medications, and then I try to gather myself and sit down at the laptop, do some of my work. Doctors, tests, scans, these things are still an ongoing thing, especially for a seronegative patient like me, because blood work just doesn't track our disease activities. So we're always having to be vigilant. And sometimes it's a struggle, to be honest with you, just balancing being a patient, being my own caregiver, and then also balancing life and work on top of it. It's a lot. There's good days, there's bad days, and some days they just are.
Yeah, good for you for plowing through and being that voice for others as well. How did you first become an advocate? What first led you into advocacy?
I had to save my own life. I reached a point where I didn't have faith or trust in doctors anymore. My gut feeling was telling me definitely something is wrong with me, even though they're not figuring it out. And I had to make a decision at some point to, am I going to fight or am I going to just let go? And I decided to fight. So once I decided to fight, I was like, all right, I will not be silent. And so I went forth asking for what I needed. I realized, okay, self-advocacy is what's going to save all of us. And that's kind of what I also try to instill in our patient community. So one way that I even advocate is by guiding them through self-advocacy, and that's how they can get the help and treatment that they need. But I've been very lucky that people have always reached out to me. Me doing the community-based work has been giving that message, sending that message of advocacy across the board. And so I was really excited when I was reached out by Infusion Access Foundation to participate as one of the 10 patient advocates this year at their Champions Weekend retreat. And I am really excited because Infusion Access Foundation really makes sure that patient communities of all kinds have access to equitable and affordable treatments across the board. So they really put in the time to train us, to kind of polish how we share our patient stories. And they actually help us get in front of legislators, policymakers, to really amplify the voices of our community, what we're lacking, what we need. And this can really help push for change for the near future. And so I'm really excited to have been a part of this. And I've already met the other 9 patients. They are amazing. I'm really excited to see what can come from this.
You mentioned that you founded a nonprofit and have become a powerful voice for others with IgG4-related disease. How did advocacy help you find purpose after so many years of feeling unheard?
When I started being loud and finally my loudness actually made sense, it came with backup, it came with evidence, it was a very enlightening feeling. And then just going forward, bringing other patients' stories to life and sometimes just talking back to doctors. When I started seeing the results is when everything started to fall into place. And then I saw the impact. I felt the impact I was having on our patient community and for the patients. Just giving them more hope, making them feel more comfortable, making them feel secure about their decisions that they're making, things like that. And those things have really ignited this passion of advocacy within me. Because now it's like, okay, we're all going for the same fight. I'm going to fight for me, for you, for our sister communities, because we're all lacking the same thing. And yeah, if I can do it, we always say those who can should. And so I can and I must.
Wow. Yeah, no, very inspirational to say the least. And, that sense of purpose shines through in everything that you do. It's very obvious. And I know it's inspiring to many others still searching for answers. And for listeners who are still waiting for answers or who feel dismissed by their doctors, what advice would you give to them?
If you have a gut feeling, trust your gut feeling, because that's ultimately what even got me to get the help that I needed. So a lot of times, like I said, we lose faith in the doctors and the medical system after some time. I would just say don't give up, be persistent. If you really feel like something is wrong, go for it. Ask for the tests, scans, and biopsies that you need. Don't let doctors walk all over you. And you pick your care team. Always pick your own care team. Even if you're confined within the limits of your health insurance, you're still able to choose from a list of doctors within each specialty. So C1, C2, C3, but you vet them. So if you feel like this doctor is not going to serve you well, I would suggest changing that doctor. Because at the end of the day, we're just a number on their roster every day. We're the ones who really care about the well-being of our own selves. And for now, you got to self-advocate. You got this.
Yeah, that's such valuable advice for everyone and a reminder that no one should have to go through this journey alone. Before we close, I want to ask if you can go back and speak to your younger self, the version of you who was still searching for answers. What would you tell her now?
I would give her a map of permissions. I would give myself permission. Permission to speak up when I didn't, permission to believe in myself, permission to stand my ground. I would give myself a lot of permissions and tell myself to trust yourself, keep trusting yourself. That's ultimately what got me to this place, but I really struggled with not knowing when I'm allowed to say something or just things like that really I struggled with. And so I'd give myself all the permission in the world to do as I please and say as I please.
Wow. Thank you, Mahsa, so much for sharing your story so honestly and courageously. Your journey highlights the emotional cost of what happens with delayed diagnoses, and your story also highlights the incredible strength it takes to turn pain into purpose. So thank you for taking the time to be with us today.
Thank you. Thank you for having me.
And to our listeners, you can learn more about IgG4-related disease at creakyjoints.org/IgG4-RD-guide. We'll drop that link into our show notes. And before we wrap up, because it's November, I do want to remind everyone it's not too late to get your seasonal flu or COVID-19 vaccine. Staying up to date on these shots helps protect you, your loved ones, and your community as we head into the colder months. To learn more about vaccine recommendations and find reliable resources for patients, visit ghlf.org/vaccines. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.